Prostate cancer is a cancer of one of the male reproductive glands, the prostate gland. That gland is essential for male reproduction. It is in many ways likened to breast cancer. It's just about as common. It is related to hormones, in this case testosterone or androgen. It also is a very common cause of cancer death in men. Prostate cancer is the most common cancer in men. About 200,000 men per year get prostate cancer. If you look at it lifelong, a man has about a 1 in 6 chance of getting prostate cancer. The risk factors for prostate cancer include age. Secondly, family history of prostate cancer. Thirdly, African American race is associated with about a 2 times higher risk of getting prostate cancer and about a 2.5-fold higher risk of dying of prostate cancer. Prostate cancer is fairly straightforward to detect. We have been fortunate to have a blood test called prostate-specific antigen, or PSA. Since it has started, the death rate from prostate cancer has dropped approximately 25% or more. A man with an elevated PSA then undergoes a biopsy. The man has about a 20% chance of having cancer on a biopsy if he has an elevated PSA. For years, we recommended men start screening at age 50. It appears that a better approach would be to start screening, get your initial PSA at age 40. If that PSA looks good, a man can wait and get another PSA at age 45, and if it continues to look good, get another one at age 50, and then maybe every other year or every year thereafter. Men who come to my clinic with localized prostate cancer, which is about 95% of men diagnosed nowadays, have no symptoms at all. They're shocked that they have prostate cancer. And it was found almost strictly because they had an elevated PSA. The things that have been associated with the risk of getting prostate cancer are high-fat diets, particularly animal fats. Some fats look like they might be beneficial, like polyunsaturated fats, fats from vegetables, fats from omega-3 fatty acids from fish. Some of the things associated with a lower risk of getting prostate cancer include eating a lot of green vegetables. By and large, what I tell patients nowadays is anything that is good for your heart is probably good for your prostate. The options for treating localized prostate cancer are active surveillance, watching the prostate cancer for signs that it'll spread. Prostate cancer is a very slow-growing cancer. For men with very small amounts of low-grade prostate cancer who might be older and have other health conditions, sometimes watching the prostate cancer is the most appropriate thing to do because they are never going to die of their disease. Surgery is probably the most common treatment for localized prostate cancer, particularly in men who are under the age of 70. The third mode of treating localized prostate cancer is radiation therapy. There are a lot of very exciting fields of research in prostate cancer right now. A number of investigators at Stanford are looking at the genetic profiles of prostate cancer to try and understand what makes prostate cancer cells tick. A second area of research is immunotherapy, revving up an individual's immune system to attack prostate cancer. I think this is the tip of the iceberg. I think immune therapy is going to be integrated into other forms of treatment, including chemotherapy of prostate cancer, to help improve and prolong men's life with advanced prostate cancer. New drugs are coming online for prostate cancer. These new drugs are in clinical trial here at Stanford and likely will enter our armamentarium in the next 5 years. This is a very exciting area of research and development.